Your liver may be silently dying right now without causing a single twinge of pain. At this very second, this vital organ is trying to process more than 500 chemical functions essential to life. But there is a biological limit, and when that limit is exceeded, the signals sent are dangerously subtle. Many confuse these warnings with simple daily stress or just passing fatigue. Ignoring these signs is like ignoring the oil light flashing on the dashboard of a car at high speed. The difference is that in your body, total system failure can be irreversible and absolutely fatal. Today, I will reveal what conventional medicine often misses in the early stages of the disease. Prepare to discover the 7 silent signs that can save your life or the life of a loved one. This is not just another health video, it's a survival guide based on clinical data. I will teach you how to identify cellular degradation before it turns into incurable cirrhosis. Stay with me until the end, because the 7th sign is the most dangerous and the one that most deceives patients. Your journey to understand the master of your metabolism begins now with revelations that will change your perception.
Hello, I'm Antônio Carlos, a biologist and clinical analysis specialist with 20 years of experience. I've spent the last 2 decades in laboratories analyzing thousands of blood tests from real people. I've seen firsthand how liver markers silently rise while the patient believes they are in perfect health. My mission here is to translate the complexity of molecular biology into language you can use. Over 20 years examining human metabolism, I've learned that the liver is the most neglected organ. Many arrive at my lab when tissue destruction levels are already at an advanced stage. That's why I decided to bring this technical knowledge off the benches and directly to your screen. Here, we combine pure science with clinical practice to offer an insight that few professionals share. You are about to see 2 decades of experience condensed into 30 minutes of pure, vital information today. My training allows me to see beyond the obvious symptoms. I see the cellular response that the body is screaming. Welcome to the Health and Wellbeing channel, where your health is analyzed from a scientific perspective. Now, let's delve into the biology of your liver and understand why it's the cornerstone of longevity. To interpret the signs, we need to understand what makes the liver the chemical master of your body. It is the only organ in the human body capable of fully regenerating itself, even if only a part remains. However, this incredible healing capacity is also what makes it so dangerous in early diagnosis. Because it can function even when diseased, it rarely causes direct physical pain in the initial stages. It processes nutrients, neutralizes toxins, stores vitamins, and regulates blood sugar with incredible precision. Imagine a factory that operates 24 hours a day, filtering 1.5 liters of blood per minute. If this factory stops, the stock of toxins rises, the blood becomes impure, and the brain suffers. Many people believe that only alcohol destroys the liver, but fat and sugar are villains. In recent years, I have seen the profile of patients change from alcoholics to people with diets rich in ultra-processed foods. Biology does not forgive excess fructose, transforming energy into fat stored within liver cells. This process is the beginning of steatosis, a silent inflammation that precedes all 7 signs discussed. Understanding the biological basis is the first step to correctly interpreting what your body is telling you.
Sign 1. Persistent fatigue. The first sign that your liver is crying out for help is exhaustion that doesn't improve with rest. We're not talking about that sluggishness after a day's work, but a deep and constant cellular depletion. When the liver is overloaded, it consumes an immense amount of energy trying to detoxify your blood. This leaves little glucose available for your other vital functions, causing a feeling of a constantly depleted battery. In the laboratory, we observed that oxidative stress in liver cells generates inflammatory mediators that reach the brain. These substances alter neurotransmitters, causing what we technically call chronic central fatigue of hepatic origin. Many patients come for tests thinking the problem is in the thyroid or iron deficiency, but when we analyze liver enzymes, we realize that the liver is struggling to maintain internal homeostasis. If you wake up more tired than when you went to sleep, your biology is sending a red alert. The liver manages your glycogen reserves. If it fails, your fuel runs out too quickly. As a specialist for 20 years, I've seen cases where fatigue was the only symptom of hepatitis. Never ignore persistent lack of energy. It's your liver's voice trying to tell you something important.
The science of liver fatigue. Biochemically speaking, fatigue occurs because the liver is the center of ATP production in the mitochondria. When liver cells, called hepatocytes, are inflamed by fat or toxins, energy production drops. The body then enters a forced economy mode, prioritizing only heartbeats and breathing. The result is that feeling of heavy legs, a foggy mind, and a constant urge to close your eyes. Many try to compensate for this tiredness with more coffee or energy drinks, which further overloads the diseased organ. Excess coffee forces the liver to work overtime to metabolize caffeine in a saturated system. In my clinical analyses, I noticed that urea and ammonia levels rise when the liver doesn't process proteins. These toxins in the blood act as true natural sedatives, but in an extremely toxic way for you. It's a vicious cycle. A diseased liver generates fatigue, and fatigue prevents you from exercising and recovering. To break this cycle, we first need to reduce inflammation in the liver's functional unit through nutrition and tests. If your fatigue is accompanied by metallic breath, the warning sign is even urgent. We are only at the first sign, and you can already see how interconnected and complex biology is.
Sign 2. The mystery of jaundice. The second sign is visual and impactful, often being the first thing that leads the patient to the doctor. It is the yellowing of the eyes and skin, a clinical phenomenon that receives the technical name of jaundice. This happens due to the accumulation of bilirubin, a pigment resulting from the natural breakdown of old red blood cells in the blood. In a state of full health, your liver captures this bilirubin and excretes it through bile. However, when liver cells are damaged or bile ducts are obstructed, the pigment leaks into the tissues. As a specialist in clinical analysis, I see the blood serum of these patients turn an intense orange color. This color in the test tubes is the exact reflection of what is happening inside their skin. Jaundice doesn't appear overnight. It is the result of prolonged saturation of the system. Often it begins very subtly, only in the corner of the eyes, under white or natural light. If you notice that the whites of your eyes are losing their vibrancy and turning yellow, don't wait. This is a sign that the filtering function is seriously compromised by inflammation or obstruction. The liver is overflowing with toxins, and your body is painting a bright warning on your own face.
Deciphering bilirubin in the laboratory. For us clinical analysts, measuring total bilirubin and its fractions is a window into the organ's interior. There is indirect bilirubin, which has not yet passed through the liver, and direct bilirubin, which has already been chemically processed. The ratio between them tells us exactly where the problem lies, whether it's in the blood or the liver. If direct bilirubin is high, we know that the liver has managed to process it, but cannot expel it into the intestine. This may indicate gallstones or severe inflammation in the ducts that transport the precious bile. Today, bile is essential for the digestion of fats and the elimination of heavy metabolic waste from the body. Without this continuous flow, the body begins to self-poison, causing damage to other organs such as the kidneys. Over 20 years, I have noticed that many ignore the slight yellowing, thinking it's just their skin type. But human biology doesn't lie. Yellow is the color of bile stagnation and impaired excretion. A simple test can differentiate between hemolytic anemia and a silent, serious viral hepatitis. Early laboratory diagnosis here is the difference between simple treatment and immediate emergency hospitalization. Protect your vision and your skin by monitoring this sign, which is one of the most classic in liver medicine.
Sign 3. Silent abdominal pain. The third sign manifests as discomfort or swelling in the upper right side of your abdomen. Many describe it as a feeling of heaviness or constant pressure just below the ribs on the right side. Because the liver doesn't have internal pain-sensitive nerves, it only hurts when it grows too large. As it increases in size, it stretches the capsule that surrounds it, called Glissen's capsule, which is nerve-containing. Therefore, if you feel pain in this area, your liver is probably already inflamed and enlarged. This can be caused by fat accumulation, which we call fatty hepatomegaly in our technical reports. In 20 years of analysis, I've seen many patients ignore this weight, thinking it was just a digestive problem. They take antacids or gas medications, masking an inflammatory process that continues to silently destroy liver cells. Abdominal swelling can also indicate fluid accumulation, a very serious condition known in medicine as ascites. Ascites occurs when the liver becomes so hardened that blood cannot flow freely through it. This increases pressure in the veins, and fluid leaks into the abdominal cavity, causing the belly to swell. If you feel that your clothes are tight around the waist, but your arms are thin, pay close attention.
The danger of fatty liver, steatosis. Fatty liver disease is the silent epidemic of the 21st century, affecting millions of people without symptoms. In the laboratory, we see this through the elevation of a specific enzyme called gamma-GT, the marker of aggression. The fat infiltrated between the hepatocytes causes an inflammatory reaction that destroys the functional architecture of your organ. Over time, this fat undergoes oxidation, generating scar tissue that we technically call chronic hepatic fibrosis. The more scarring, the less functional liver you have to maintain your 500 vital functions working fully today. Many believe that having a little bit of fat in the liver is normal, but biology totally disagrees. There is no safe level of fatty infiltration in an organ that should be purely functional and free of storage. Visceral fat, the kind that lies between the organs, is metabolically active and releases toxins into your circulatory system. These toxins increase insulin resistance, leading you straight down the path to type 2 diabetes soon. My clinical experience shows that reversal is possible, but it requires immediate intervention before it turns into cirrhosis. Abdominal ultrasound and blood tests are your greatest allies in detecting this silent and dangerous sign. Never underestimate a distended abdomen. It may be the reservoir of inflammation that is consuming your life.
Sign 4. Urine and stool color. The fourth sign is something you can and should monitor every day: your bodily excretions. If your urine is very dark, like black tea or cola, something is wrong. This indicates that bilirubin, which should be excreted in the stool, is being filtered incorrectly by the kidneys. At the same time, observe the color of your stool. If it is pale, the color of putty, this phenomenon is called acolic stools, and it is a clear sign that bile is not reaching the body. Bile is what gives healthy stools their characteristic brown color through a pigment called stercobilin. If the stool is pale, bile flow is interrupted, or the liver is not producing enough today. As a specialist in laboratory tests, I know that this alteration is an urgent marker for biliary tract obstruction. Often, the patient notices dark urine first and thinks it's just dehydration due to lack of water. But if, even after drinking plenty of water, the color remains dark and concentrated, the problem is chemical and hepatic. The excretory system reflects your internal health, and the liver is the master of these colors. Pay attention to the toilet bowl. It may provide the diagnosis you need, even before any tests.
Biochemistry of altered excretions. The change in color occurs due to a profound metabolic shift that alters the entire balance of your renal system. When the liver fails, the kidneys attempt to compensate for detoxification, but they are not designed to filter bile pigments. This causes irritation in the renal tubules, which can lead to secondary failure in both kidneys. In the clinic, we call this dangerous interaction hepatorenal syndrome, one of the most difficult complications to treat in the hospital. In my 20 years of experience, I have learned that floating, greasy stools are also an important warning sign. This indicates that dietary fat is not being emulsified by bile and is passing straight through the intestine. Malabsorption of fat-soluble vitamins, such as A, D, E, and K, begins to occur at this exact moment. Without vitamin K, for example, your liver cannot produce the clotting factors in your blood. This explains why patients with liver problems frequently experience easy bleeding from the gums or nose. Everything is connected, from the color of your urine to your blood's ability to stop bleeding from a simple cut. Biology is a house of cards. If the liver card wobbles, the entire health structure collapses. Whenever you notice persistent changes in the color of your waist, seek a clinical analysis specialist for investigation.
Sign 5. Persistent skin itching. The fifth warning sign is intense, persistent itching that seems to come from beneath your skin. Unlike a common allergy, this itching doesn't present with visible red spots or rashes on the skin surface. It's an irritating sensation that usually worsens significantly at night, preventing sleep and causing great physical agitation. This occurs due to the accumulation of bile salts in the bloodstream, which end up deposited in the peripheral integumentary tissue. These salts irritate the nerve endings in the dermis, causing an uncontrollable urge to scratch the entire body incessantly. As a clinical specialist, I see patients with nail marks all over their bodies, but with skin that appears allergy-free. Many spend months using moisturizing creams or corticosteroids without success because the problem is internal, not external. The liver is so overloaded that it cannot eliminate bile acids, and they seek an outlet through the skin. This is a very common symptom in diseases such as primary biliary cirrhosis or chronic cholestasis today. Itching can start on the palms of the hands and soles of the feet and then spread to the torso. If you scratch and don't know why, your liver may be trying to expel accumulated toxins. Don't ignore what your skin is telling you. It's a mirror of what's happening in your internal laboratory.
Liver pruritus and quality of life. Pruritus of hepatic origin is one of the most distressing symptoms for the patient, severely affecting their mental health. Sleep deprivation caused by nighttime itching generates irritability, depression, and a drastic drop in the individual's immunity. Biochemically, we believe that there are also substances called endogenous opioids that increase this perception of itching in the nervous system. In the laboratory, when we measure total bile acids, we confirm this elevation that justifies the patient's reported physical suffering. In 2 decades of analysis, I have learned that relieving the liver is the only real way to stop this itching. Diets rich in fiber help to sequester these bile salts in the intestine, preventing them from returning to the bloodstream. But this is only a palliative. We need to treat the cause of bile stagnation in the nucleus of liver cells. Often, this sign precedes the appearance of yellowing in the eyes by months, being a vital early warning. If you notice that the itching increases after eating fatty foods, the causal link with the liver is evident. The human body uses the skin as a secondary kidney or liver when the main organs fail. It's a desperate defense mechanism to prevent the heart and brain from being affected by bile toxins. Taking care of your liver is literally giving your skin and central nervous system a rest.
Sign 6. Nausea and loss of appetite. The sixth sign manifests in your digestive system through frequent nausea and a sudden loss of appetite. You start to feel that food doesn't sit well, especially meats, fried foods, or heavier, fattier foods. This happens because the liver is the main producer of bile,
a substance essential for breaking down and absorbing fats. With compromised bile production, the stomach and intestines struggle to process food, generating discomfort. The feeling of bloating after eating only a small portion is a classic warning sign of slow hepatic metabolism. In my daily laboratory work, I see this leading to unintentional weight loss and hidden malnutrition. Many people think it's gastritis and start taking gastric protectors that can even impair nutrient absorption. A diseased liver also alters the levels of hormones that control hunger and satiety in your brain. The result is a loss of interest in food, and in more serious cases, a repulsion to strong kitchen smells. If you are losing weight without dieting and feel constantly nauseous, your liver may be inflamed. Nausea is the body's way of saying, "Don't send any more load. I can't process what I already have." Respect your digestive system and investigate the origin of this persistent nausea with imaging and blood tests.
Fat and enzyme metabolism. To understand hepatic nausea, we need to look at the enzymes the liver releases to aid digestion. In addition to bile, the liver regulates the availability of cholesterol and triglycerides circulating in your blood after meals. When the organ is under stress, this regulation fails, causing spikes in inflammatory substances in your gastrointestinal tract. Today, in 20 years, I've noticed that morning sickness is very common in people with advanced fatty liver disease. This occurs because during the overnight fast, the liver should be cleaning the blood, but it's only suffering. Upon waking, the system is saturated with metabolic waste that causes this feeling of nausea and a bitter taste in the mouth. A white tongue upon waking is also an indirect sign that the detoxification system is overloaded. Treatment here is not just a remedy for vomiting, but a strategy for regenerating liver cells. Reducing the organ's workload through a light diet is the first step towards restoring appetite. Remember that the liver is the body's central laboratory. If the laboratory is on strike, nothing works. Clinical nutrition is the basis for restoring the liver's productive capacity for enzymes and bile acids. The sixth sign is an invitation for you to rethink what you are putting into your chemical factory.
The danger of masking symptoms. One of the biggest mistakes I've seen in 20 years of practice is the indiscriminate use of digestive medications. People feel heaviness in their liver and take effervescent salts, analgesics, and anti-nausea medications on their own. This creates a false sense of security, while the underlying disease continues to progress toward tissue fibrosis. Many of these medications are metabolized by the liver, increasing stress on already diseased cells. Paracetamol, for example, is extremely hepatotoxic if used in high doses or for prolonged periods without guidance. By masking nausea or abdominal pain, the patient misses the window of opportunity for curative treatment. Human biology uses pain and discomfort as communication tools to preserve the individual's life. If you silence the symptom without investigating the cause, you are simply turning off the alarm while the house burns. I always tell my patients, the laboratory doesn't lie, but the symptom can be misleading if it is suppressed. Try to understand the reason for the nausea instead of just wanting it to magically and quickly disappear. True health comes from understanding biological processes, not from chemically suppressing your body's messages. Now let's prepare for the seventh and most dangerous sign, which affects your central command center, the brain.
Sign 7. Spider veins and spots. The seventh sign is dermatological, but it reveals a profound hormonal imbalance caused by liver dysfunction. It consists of spider veins, small dilated blood vessels that spread across the patient's chest, shoulders, and neck. They have a central red spot with fine branches that resemble spider legs on the skin's surface. This happens because the diseased liver can no longer metabolize estrogen, which ends up rising in the bloodstream. The excess estrogen causes the dilation of these small capillaries, creating these visible marks that don't disappear on their own. In addition,
Purple spots that appear without any injury are a warning sign of impaired blood clotting. Since the liver produces the proteins that stop bleeding, a lack of them causes these small internal leaks. In 20 years of laboratory work, I've seen that these skin signs coincide with low levels of albumin in the patient's blood. Albumin is the main protein in the blood. If it's low, the liver is in a state of failure. Another skin sign is excessive redness on the palms of the hands, technically known as palmar erythema of hepatic origin. Your skin is trying to show what your blood can no longer hide beneath the cell surface. These signs indicate that the disease has progressed beyond its initial stage and is already affecting systemic hormonal balance.
Hormonal imbalance and the liver. The liver is the main regulator of sex and metabolic hormones in men and women of all ages. When it fails, men may notice breast growth, a condition called gynecomastia, and loss of body hair. In women, the estrogen imbalance caused by liver failure can lead to severe changes in the monthly menstrual cycle. This all happens because the liver is where hormones are inactivated and prepared for elimination. If the disposal machine breaks down, the hormones continue to circulate and exert unwanted and dangerous effects throughout the body. This generates a state of chronic inflammation that affects even the thyroid and cortisol production. In my clinical analyses, I see that the ratio between free and bound hormones changes drastically in chronic liver disease. This explains the change in skin texture, which becomes thinner, and the accelerated loss of muscle mass. The liver is an indirect endocrine organ of extreme importance for your vitality and aesthetic and physical appearance. Taking care of your liver means maintaining your hormonal youth and the integrity of your blood vessels for longer. Spider veins are not just a cosmetic problem, they are a sign that your hormonal system is malfunctioning. Never ignore strange marks on your skin that appear without logical explanation. They are a map of your internal health.
The final danger: hepatic encephalopathy. There is a consequence of the seventh sign that is the most frightening of all: mental confusion and disorientation. We call this hepatic encephalopathy, a state where the brain is intoxicated by substances that the liver has not filtered. The main culprit here is ammonia, a byproduct of protein metabolism that is extremely toxic to neurons. A healthy liver transforms ammonia into urea to be safely and efficiently excreted by the kidneys today. When the liver fails, ammonia rises, crosses the blood-brain barrier, and begins to shut down cognitive functions. The patient may exhibit personality changes, severe forgetfulness, daytime sleepiness, and nighttime agitation. In the early stages, it seems like just mental fatigue, but it can progress to hepatic coma in a few hours. As a specialist for 20 years, I have seen families think the elderly person had Alzheimer's when the problem was the liver. The blood ammonia test is a vital tool we use to detect this imminent risk of nervous breakdown. The trembling hand, which we call flapping or asterixis, is the physical sign that the brain is under chemical attack. This is the stage where medical intervention needs to be immediate, aggressive, and performed in an emergency hospital setting. Your mind depends on the cleansing that your liver performs on your blood with each beat of your heart. The liver-brain axis. Modern science has discovered that the liver-brain axis is far more powerful than previously imagined in classical medicine. The liver sends constant chemical signals to the brain about the nutritional status and toxicity of the body as a whole. When the liver is inflamed, the brain also becomes inflamed, leading to depression and anxiety of metabolic origin. Many treat the emotional aspect with medication, but the real cause lies in the accumulation of toxins that the liver has not removed. In 20 years of analysis, I have observed that improved liver function brings almost immediate mental clarity to the patient. Brain fog is often a reflection of a liver overloaded by an inflammatory and toxic diet. Ammonia is not the only culprit.
Other substances, such as false neurotransmitters, are also produced by the diseased gut and liver. These molecules compete with dopamine and serotonin, altering your mood and motivation for life. Therefore, keeping the liver clean is essential for maintaining your mental health and your ability to focus. The biology of mood necessarily involves the efficient and constant filtering of all toxins from our blood by the liver. If you feel your mind isn't what it used to be, look closely at your liver function tests. The seventh sign is the final limit of your body's biological resistance against severe metabolic self-intoxication.
Why does the liver get sick? Today, we live in a world that is a true battlefield for our liver every day of the week. In the past, the main cause of liver disease was alcohol and viral hepatitis transmitted through contact or blood. Today, the main cause is non-alcoholic fatty liver disease, driven by excessive consumption of sugar and fructose. Industrialized fructose, present in juices and soft drinks, is metabolized exclusively by the liver, just like common alcohol. The excess of this energy is transformed into fat within the hepatocytes, initiating a process of inflammation and cell death. Added to this is the constant exposure to pesticides, heavy metals, and chemical additives present in ultra-processed foods today. The liver tries to neutralize all of this, but the modern chemical load far exceeds its evolutionary filtering capacity. As a clinical specialist, I see children with livers like those of alcoholic adults due to the excessive consumption of processed snacks and sweets. A sedentary lifestyle also contributes, as the muscle doesn't consume the energy, and the liver ends up being the final storage site. Human biology hasn't changed in the last 10,000 years, but our chemical environment has changed drastically in decades. We're overloading our main filter with substances that it doesn't even recognize as safe food or fuel today. Understanding the modern causes is the first step in creating an effective defense strategy for your longevity.
The role of laboratory tests. As someone who has lived among test tubes for 20 years, I affirm tests are your compass in health. Don't wait until you feel pain to ask your doctor for a complete liver panel to assess your vital functions now. AST and ALT enzymes indicate cell death. When cells rupture, these enzymes leak into the bloodstream. Gamma-GT and alkaline phosphatase show if there is any degree of obstruction or toxic damage to the bile ducts. Often these numbers rise years before any of the 7 signs we discussed here appear on the skin. Albumin levels and prothrombin time assess whether the liver can still produce what you need. A simple blood count can show low platelets, which is a very strong indirect sign of progressing cirrhosis. In the laboratory, we can see the fire starting long before you smell the smoke on your body. Early diagnosis through clinical analysis is the only way to guarantee the complete regeneration of the liver today. Always ask to see your report and compare the results with reference values and previous years as well. A small deviation can be the beginning of a process that will take years to manifest in a serious physical form. The clinical analysis laboratory is your greatest ally for longevity and your metabolic safety against silent diseases.
Interpreting the results, AST and ALT. Many patients are confused by the abbreviations AST and ALT, but they tell a very clear story about their cells. ALT is more specific to the liver. If it is high, the damage is almost certainly in functional liver tissue. AST is also present in the heart and muscles, being a more generalized and systemic marker of cellular aggression. When both are elevated, we know there is an active process of necrosis, that is, death of liver cells. This can be caused by a virus, excess fat, medications, or environmental toxins you ingested today. The reference value should not be your only guide. Ideally, these levels should always be low. If your levels are rising every year, even within the limit, your liver is under increasing stress.
In 20 years, I have seen that small, constant elevations are more dangerous than a single peak that then drops quickly. The persistence of the elevation indicates that the cause of the inflammation has not been removed and the damage continues to progress silently. Don't ignore a slightly altered result. In biology, a slightly altered result is the beginning of a predictable future failure. Take your tests seriously and discuss each marker with a professional who understands the pathophysiology behind the numbers. Clinical knowledge is the bridge between a paper test result and the preservation of your life and well-being.
The importance of gamma-GT. Gamma-GT is an enzyme that is often overlooked, but it is the toxicity sensor of your liver. It rises rapidly in response to alcohol consumption, but also to excess fat and the use of certain medications. If your gamma-GT is high, your liver is sending a clear signal of oxidative stress and biliary inflammation. It is one of the most sensitive markers for detecting fatty liver disease, even before ultrasound shows anything visual. In the laboratory, we use gamma-GT to monitor whether the patient has actually stopped harming the liver with toxic substances. It can also rise in cases of heart problems, showing how the liver suffers when circulation is poor. Over 2 decades, I have found that lowering gamma-GT is one of the first signs that treatment is working. It is a marker of progress that motivates the patient to continue on the path of clean eating and natural detoxification. Often, high gamma-GT is the only sign in people who appear perfectly healthy on the outside but are inflamed. Maintaining this index ensures that the channels that transport bile and toxins remain clean and unobstructed. Laboratory science gives us the eyes to see the invisible and the chance to act before liver disaster strikes. Never accept an elevated gamma-GT as normal. It's a warning sign from your filtration system. Proteins and coagulation. The liver is the body's main protein factory, producing albumin and factors that stop bleeding. When the liver becomes chronically diseased, the production of these essential proteins begins to fall dangerously below the minimum level. The drop in albumin causes fluid to leak from blood vessels into tissues, causing swelling. This explains why patients with liver problems have swollen legs and a fluid-filled abdomen. Failure of clotting factors means that even minor trauma can result in large purple bruises on the skin. In the laboratory, we measure this through the PT or INR, which assesses how long it takes for your blood to clot. If the blood takes too long to clot, we know the liver is no longer able to produce what it should. This is a sign that the organ's functional reserve is running out, a stage of great risk. In 20 years, I have seen how nutritional protein replacement can help, but the liver needs to be able to process them. Protein synthesis is the heart of life. Without it, the body collapses, loses muscle mass, and loses vital immunity. The liver also produces proteins that transport iron, copper, and hormones throughout the circulatory and cellular systems. Its physical structure depends directly on the productive capacity of this organ, which we often ignore in our daily lives. The path to natural regeneration. The wonderful news that biology gives us is that the liver is the master of regeneration and healing. Unlike the heart or brain, liver cells can multiply and efficiently replace damaged areas. For this to happen, we first need to remove the offending agents, excess sugar, alcohol, and processed foods. Giving the liver a metabolic rest is the most effective strategy to begin the process of cellular cleansing and restoration. Bitter foods, such as artichokes and chicory, stimulate bile production and aid in the organ's natural detoxification. The use of compounds like silymarin, present in milk thistle, has scientific support for protecting liver cell membranes. Increasing the consumption of cruciferous vegetables, such as broccoli and kale, provides the sulfur necessary for the chemical detoxification phases. As a clinical specialist, I have seen livers with severe fatty liver disease return to normal in just 6 months of consistent changes and focus.
Water is the universal solvent that helps the liver direct toxins to the kidneys and intestines. Getting enough sleep is fundamental, as it is during deep sleep that the liver performs its most important internal cleansing tasks. Regeneration is a programmed biological process. You just need to provide the building blocks and the necessary time for your body. It's never too late to start taking care of your chemical master. It's ready to recover if you allow it. Foods that heal the liver. Functional nutrition is your greatest tool for restoring liver health without the use of drugs. Turmeric is a potent anti-inflammatory that protects cells against oxidative damage and progressive fibrosis. Consuming choline, found in egg yolks, is essential for transporting fat out of the liver and preventing accumulation. Garlic contains selenium and allicin, substances that activate enzymes that help the body expel heavy toxins from the blood. Good fats, such as extra virgin olive oil, help reduce fat levels in the liver itself effectively. In my analyses, I observed that patients who adopt these diets show a rapid drop in transaminases and gamma-GT as well. Avoiding trans fats and refined vegetable oils removes an immense inflammatory load from the cellular and systemic hepatic system. Beetroot contains betalains, which protect the liver against damage caused by external chemicals and metabolic waste from the body. Eating mindfully means making your food your first and most powerful medicine for a long life. The liver responds quickly to positive changes. In a few days, energy returns and mental clarity begins to emerge. Biology rewards care with vitality, less bloating, and much more radiant and healthy skin on the outside. Be the guardian of your inner factory, choosing what enters it with the utmost wisdom and scientific knowledge. The final retention, the seventh sign revealed. We've reached the crucial point where knowledge translates into immediate preventative action for your health and survival. We've seen how fatigue, jaundice, pain, the color of your stools, itching, and nausea tell a story. But the most dangerous sign is the one that affects who you are, your cognition and mental state. If you feel slow, forgetting simple words, or experiencing uncontrollable sleepiness after eating, sound the alarm. Hepatic encephalopathy is the boundary between treatable disease and a life-threatening medical emergency. As a biologist for 20 years, my appeal is that you don't wait until you reach this point of nervous and chemical collapse. The 7 signs are your body's hands trying to pull you away from an incurable health precipice. Every skin blemish, every morning sickness, and every change in urine color is an opportunity for healing. The liver is patient and resilient, but it is not indestructible in the face of decades of constant nutritional and chemical abuse. You now possess the visual and biological map to monitor your internal laboratory every day of your life. Awareness of your own body is the first step towards true longevity and lasting, real well-being. Don't let the silence of your liver deceive you. Learn to hear the whispers before they become screams. The practical action plan. What should you do tomorrow morning to ensure your liver is functioning like a precision machine? First, schedule an appointment and request a complete laboratory checkup, focusing on the markers we discussed in depth today. Second, eliminate all added sugar and alcoholic beverages from your daily diet for at least 30 days. Third, increase your water intake to at least 35 milliliters per kilogram of body weight, aiding renal and hepatic filtration. Fourth, include dark green vegetables and root vegetables like beets and carrots in all your main meals today. Fifth, monitor your sleep. If it is disrupted, it may be an early sign of toxin buildup in the nervous system. Sixth, exercise, as active muscle helps the liver burn stored fat much faster. Seventh, avoid using over-the-counter medications, as self-medication is one of the leading causes of fulminant hepatitis worldwide. In 20 years of clinical experience, I have seen that these simple steps save more livers than complex and delayed surgical interventions. Discipline today is what will ensure you don't need a transplant or painful treatments in the near future. Take responsibility for your biology. You are the only one who can truly protect your internal chemical master at all times. Science is on your side, but action depends solely on your will to live life to the fullest and in the best possible health.
We've reached the end of this documentary about the life and resilience of the most fantastic organ in the human body, the liver. I hope this information, based on 2 decades of clinical analysis, serves as a protective shield for your health today. If this content opened your eyes to something you were unaware of, my mission as a biologist and educator has been accomplished. Remember that knowledge is the only tool that no one can take away from you and that truly transforms your reality. Share this video with those you love. Accurate information has the power to save lives and prevent serious illnesses. Subscribe to the Health and Wellbeing channel to continue this journey of health grounded in biology and applied science. Leave your comment below. I make a point of reading them and bringing new topics based on what you really need to know. Activate notifications to be the first to know when we bring new discoveries from the fascinating world of laboratories and health. Your health is your greatest asset. Treat it with the respect, care, and science it deserves every day. Thank you very much for joining me for these 30 minutes of total immersion in the vital world of liver and clinical health today. I'm biologist Antônio Carlos, and it was an honor to share my 20 years of experience with each of you here. God bless you all, take good care of your liver, and we'll see you soon in our next video for more on life.